Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Brian Burton, who is the CEO of the Arkansas Food Bank. Brian, thanks for being here.
Thanks for having me.
So it's a big month. You guys
It
have a lot
is.
of big things happening. Tell us about it.
Hunger Action Month happens every September. And it's really just an opportunity to raise awareness about the magnitude of food insecurity. Most people don't realize how prevalent it is. But not only the need, but what are solutions, what are opportunities to get involved and to make it better, because hunger is a solvable problem.
So what does that look like for Arkansas? Where do we rank nationally?
Well, not great. I mean, we've never been fantastic, but the last 2 years, regrettably, we've been number one, according to USDA surveys, in the nation. That's the most food insecure state. We jumped from about 16% of our population to 18.9% in this latest report that just came out 3 weeks ago. And so that's about 1 out of 5. That's if that was a flu, you'd call it an epidemic, right? So it's 1 out of 4 kids. And of course, some of these rates vary within demographic groups and kind of the region of the state that you're in. So we're very top of mind at the Arkansas Food Bank in being able to capture that data, understand it, translate it, interpret it to the public, and then more importantly, come up with some really great effective programs that can help put a dent in that.
So let's talk about what part of the state. You say food insecurity, it's rampant in epidemic level. Is that all over Arkansas? Is there specific areas?
It is all over Arkansas, but it won't surprise you that the Delta area has the highest, and that's the persistent poverty for generations has been a real struggle there. Central Arkansas is fairly high. But I think people in Northwest Arkansas would be surprised. They have about 90,000 food insecure people in Northwest Arkansas. And we think of that as the economic paradise of the state. And certainly they're the growth hub for us. But it is not a respecter of a locale or race or religion or anything else. Hunger is pervasive. And I think as long as we have a lot of people who are not able to make livable wages and you have to struggle on, getting by with, 2 or 3 jobs, it's a hard scrabble life. The working poor is what we oftentimes call them. They're going to need a little bit of extra help from time to time.
So you mentioned programming. What are the specific programs that you want the healthcare community to know?
Absolutely. Well, Arkansas Food Bank, we have food for family, food for seniors, and food for kids. So you try to look at the most vulnerable groups when you're looking at the whole problem. And so seniors have really come on the radar in recent years. Arkansas is one of the top places for retired people to move to now. And so we're very mindful that that generation, I call them the builder generation, oftentimes very proud. They don't want to ask for help. And so we have found some ways to connect with them that have a lot of dignity, and more of them are willing to receive some of the assistance that they deserve. With kids, we think about our Backpack for Kids program that it was actually started here in Little Rock many years ago. And we have school pantries. We have just tailor-made programs during the summer. Thanks to our senior senator, Bozeman, we had a summer EBT this year for the first time, and so those families got an extra $120 per child that they could go spend at the grocery store to get a little bit more food, which is good. And then food for families, we have 330 food pantry partners in 33 counties around our service area, and that's really the core of our distribution. 90% of the food that goes out of our 100,000 square foot warehouse on 65th Street moves out because of those pantry partners. I call them our angels, our heroes on the front lines, and they're out there meeting the people. About 200,000 people a year flow through those pantry partners. But we can talk about healthcare in a minute too, because I know your audience wants to hear about that.
Well, let's talk about that.
Sure.
So what do you want the PCPs, those physicians,
Yes.
the healthcare communities that are seeing these poverty-stricken families that
Right.
are having a real need for it?
Right.
What do you want them to know?
Well, I want them to know, first of all, this isn't your mother's or grandmother's food bank. I mean, food banking has improved greatly in the last 10 to 15 years. So we're not just about filling bellies or just pushing any type of food out the door. Feeding America, who we're accountable to in Chicago, the largest domestic hunger relief organization in the world, we shoot for 70% food as being high nutritional value. We call it food to encourage. And so a big part of that has been increasing our fresh produce. And so we've actually doubled that in the last 6 years. So it's about 10 million pounds, which is about a fourth of our 42 million pounds. And so that's a big change from the past. And plus produce, as we know, is not only healthy and good, but sometimes a little hard for lower income people to access because they may not be in a rural town with a nice, well-stocked supermarket. They may be depending on a convenience store, or it may just be priced out of the family budget because that can be expenses. I picked up a bag of oranges in the grocery store the other day and it was $9. And so that's not that hard for me, but for a lot of people that's tough. And so we're really focused on more better choices, more choices, healthier choices that folks can choose from in these pantries, and to educate them. Arkansas Hunger Relief Alliance has a wonderful program called Cooking Matters, where they go in and train people, how to prepare the food and how to do that on a budget, how to make it culturally appealing as well as healthier. And so the other big emphasis I want everyone to know is the Food is Medicine program. 2 years ago, Feeding America put $14 million into 20 different food banks, including here in Arkansas. And we're really tasked with that program to work closer with healthcare providers and to work to see if they would do some screening for some of their patients to see who is food insecure and make referrals directly to the pantries that are closest to them. So the chair of our board is Sharonda Love, and she works at Arkansas Children's Hospital. And so that really helps us to be advantaged there as well. And we also have Dr. Jerry Jones from St. Vincent's on our board now. And so those two are great pillars that are helping us stay focused on the latest trends in terms of marrying the food banking world with the healthcare providers. And the other piece of that is to try to make more access to public assistance programs like SNAP and WIC. As we know, Arkansas is a laggard on participation in those programs. 80% of food insecurity is met through some form of federal nutrition program. And so for every meal the Arkansas Food Bank provides, SNAP provides about 10 to 12 meals. So you can see it dwarfs what the charitable sector can do. So we now have 3 people on staff that are enrolling people in SNAP. The Hunger Relief Alliance has a hotline. So we're all hands on deck there. And I would just encourage the healthcare providers, please provide literature, information on how to enroll people in SNAP and WIC, because that's our tax dollars that, are going to Vermont and Massachusetts. We want them to come back here, and we want them to be able to have healthier people that miss less work, miss less school, and are just healthier, don't need the medical, don't need the healthcare system.
So what do you want them to do to get that information? Can they reach out to your
Yes.
office, to the food bank website? What's the best way to do that?
ArkansasFoodBank.org is a great resource, and from there they can see portals into the Feeding America and the Arkansas Hunger Relief Alliance. And certainly they can call our office, ask for Ebony Mitchell or Brian Burton or one of our staff, and we'd be more than happy to connect them to the right resources. I think the silver lining in this last setback with the pandemic was we're all being forced now to not just be lean and mean, as they say in the business world, but lean and meaningful. And so we're all getting smarter about how can we work together better? How can we stretch the donor resources? Because, everyone's a little thin these days. And how can we multiply those and magnify that? That's what a nonprofit is supposed to do. And so our goal is for 96 cents of every dollar to go directly into programs. And we're advantaged to do that because of our size and our infrastructure. And so we can just be very efficient purveyors of all of this good information and connection and collaboration, and really be a multiplier for the people who are in need or oftentimes lost. They just don't know. And they're not any less intelligent than any of us. They just haven't had the advantage of the information and the resources that the rest of us have. And so I feel the weight of that responsibility to be their advocate, their voice, and to really cradle our arms around them so that they can get the help that they need. Yeah.
Well, thank you for talking about that. And what else before we go? What programming and things do you have ahead coming up this fall that we should look for?
Well, of course, we always ramp up for the holiday season because it is just a happy time for everybody, and just be mindful of our neighbors. They're also trying to anticipate having more family around the table for Thanksgiving and Christmas, and trying to plan and have that dignity. And so if people can think of creative ways to be a little more generous this year. I know I always get the question, should we do a food drive or should we donate money? I said, well, it depends on what you want to do. If you want to create awareness, do a food drive. Sometimes people do that as a team building thing or something for their church. However, if you want to feed the most people, give me $1 and I'll turn that into 5 meals. So what you can buy for 1 can of vegetables at the grocery store, I can buy 5, 6, or 7 of those. So it really is amazing the leverage that we have through our network. We get a lot of donated food, and those dollars just sing when we get a hold of them. And again, that's an economic stimulus for all of our partners and 33 counties, many of whom are very much struggling economically. And so all of that comes because I do think we sometimes forget that our destinies are intertwined. We're all in this together. We need immigrants. We need people who are older. We need people who are younger. And all of us bring something essential to this beautiful matrix of people in Arkansas that, are striving not to be number one in food insecurity, but number one in compassion and thriving and generosity. And that's who we know we are, folks who are from here. But a lot of times we get that negative PR. I was on a call with some colleagues from Mississippi and Louisiana the other day, and I said, look, I don't want to be selfish. I'm happy to give you all this notoriety next year because we're going to work ourselves off this list. So Louisiana and Mississippi, please take over. We're not going to be number one after this year.
Well, I hope that we fall off the list too.
I know.
But I thank you for talking about this, sharing this important information.
Happy to.
And thank you for all that you do to keep those that are healthy and that struggle with food insecurity, and all for the better of Arkansas. Thank you.
It's a profound privilege, and it's really a sacred type of work that we do. We always think about the sanctity of it, but thank you for that affirmation, for the opportunity to communicate with your viewers.
Well, thank you. Well, that's it for this episode of AFMC TV. Have a great day. Thanks for watching.